Hi, my name is McLaughlin, and I'm an author of the book called Cognitive Dominance, A Brain Surgeon's Quest to Outthink Fear. And I live in the Princeton area. The story in the book I want to read is called Oksana. Oksana is 5 years old. I have a toddler just like her at home. They wear the same kind of plastic hair bows. My daughter Kaylee likes the blue ones. Oksana's is white. I know because I'll keep it in my left scrub shirt breast pocket for the next 22 years. I'm in the Oakland neighborhood of Pittsburgh, the epicenter of the medical services for the tri-state area, Western Pennsylvania, Eastern Ohio, and Northern West Virginia. It's the mid-Atlantic equivalent of New England's Longwood Medical Center in Boston. 33 years old and still greener than corn in Westmoreland County, I'm smugly wearing one of those official white doctor's coats with Mark McLaughlin, MD, on it, and covering the emergency room as a neurosurgery consult. It's 7:05 a.m. in the humid heart of the early summer, and I'm eager to put all of those hours of cutting up cadavers and watching other surgeons do their work to the test. The typical neurosurgeon puts in close to 50,000 hours over a 7-year residency stretch. I'm 15,000 hours in, the dangerous time when you have some skills but lack experience. 5 minutes after meeting Oksana, I've convinced her mother to sign the surgery consent form. Oksana's head looks like a 3/4 of the way into the slow inflation of a regulation basketball. She's lethargic, sluggish, delayed. A clear case of hydrocephalus, water on the brain. Excessive cerebrospinal fluid is collecting deep inside her head, and it must be drained immediately. If it isn't, the drip, drip, drip buildup of fluid will slowly squeeze her brain until it shuts down completely, an internal mental drowning. I explain my reasoning and diagnosis to the attending neurosurgeon, and he tells me I'll be doing the operation. He'll be right next to me, but the tools will be in my hands. Thankfully, my hands are my strongest feature. We get into the room at 7:35 a.m. What I do today before an operation is different than what I did when I was a rookie. Rookies rely on rapid memory recall, probably because their minds are so young and sharp, and they've spent so much time practicing technique that the connection between thought and action is fresh, clear, practically automatic. The stress of the moment compels them to obsess about what they've been told and repeatedly trained to do, not about what they've actually experienced in the past or what they can anticipate for the future. Veterans, though, understand that present performance requires intimate knowledge of the past while constantly projecting possible outcomes into the future. Now I rely on my internal Socratic method to prepare myself for the unexpected. Here's what I do on this day. The anesthesiologist administers his potions, and Oksana is rapidly asleep. After her breathing tube is inserted, I position her head on a jelly donut, a soft neoprene cup that eliminates any pressure sores from forming on the back of her head during long procedures. I unclip her plastic hair bow, and not having a place for it, stuff it into my shirt scrub breast pocket. Her golden hair parts with ease as I comb the line of our planned incision. Is there anything softer than a child's skin? The clipper cuts through her hair like a lawnmower rolling over alfalfa sprouts. In kids, you have to be extra gentle when prepping the scalp because a rough scrub or clipping can lead to postoperative infection. After the betadine shampoo and paint to sterilize the area, I remark the mini horseshoe incision just behind her right frontal hairline and drape the field. I then score the incision line with a scalpel and steady my hand with a Bovie needle tip electrocautery device, a pencil-like dissecting tool that coagulates blood vessels as it cuts. I deepen the incision, taking care not to cut through her paper-thin skin surface. Gentle on the pressure mark, my attending mentor guides. In young children, excessive pressure with the cautery can cut right through the skull and into the brain, a disastrous misadventure that would undoubtedly compromise Oksana for life.